Welcome to the Fireside Chat series. This is Gray Campbell here. I am from 6 Degrees Health, and Heath Potter is also from 6 Degrees Health. Heath Potter is our Chief Growth Officer, and we are here to speak to you all about the benefits industry. The Fireside Chat series is a webinar that we created just for you folks, our business partners, and everyone in the benefits industry. We host these about once a month, and we feature industry and content experts. I'll introduce Lester Morales here in just a moment. They speak on the hottest topics of the industry. You know, what's shaking in the industry right now and what we all want to learn about. In case you're wondering who we are at 6 Degrees Health, we are a service-first cost containment company. We work with all sorts of employer groups, whether you have decided to leave the constraints of a traditional network or not, we've got you. We are proud to bring integrity to what historically amounts to opaque billing practices. We leverage unparalleled clinical expertise and innovative data technology to empower these employers and their covered employees so everybody can realize the true benefits of healthcare. It is a benefit after all, right, folks? So here we go, Lester Morales. We are going to speak about falling into the trap or ways to not fall into the trap. I do want to introduce Lester Morales. Hello, Lester.
Hello, Gray. Hello, everybody. Thanks for joining.
On the agenda today, folks, we are going to take a look at understanding the client goals and objectives. It's all about the data. Here's the important piece and something that 6 Degrees Health is so proud of. We're going to talk about data and recognize that there's no correlation between quality and cost. And then we're also going to jump into the incentives. How do they work? We're going to talk about that today, okay? Really important. If you have questions, please bring them up in the Q&A. I encourage folks to chat if they want to in the chat function. But if you actually have a question for Lester or for Heath or myself, please put that up in the chat function. We'll be going to those in the second half of today's episode. So I do want to get back to introducing our guest star. Heath,
Hey, Gray, one quick note. Use the Q&A, guys, not the chat. So
yep, Q&A.
Following the Q&A, and it looks like a couple people found it, asking why we're not doing a poolside chat. And I think the dad bod is obvious. Well, I'm not in my swimsuit right now, but
whatever. You got the dad bod. I don't. I know Lester doesn't either. We were talking about working out this morning. Lester Morales. Let's get back to Lester. Lester is a broker or benefits advisor. He's been in the industry, many years. Career-long innovator, disruptor. Certainly his business, Next Impact. It's a full-service employee benefits consulting company. He's committed to helping other companies and their advisors save upwards of 20% or more on their health benefits while improving the quality of the coverage being offered. If you look at his track record, Lester Morales, I actually picked up a magazine article. He was on Forbes. Were you on the cover of Forbes magazine, Lester?
No, I was buried on the bottom. Don't worry about that.
Okay, I was like, dude, this guy was on the cover of Forbes. He's the definition of the word entrepreneur. He served as the Executive Vice President, Chief Growth Officer for Willis Human Capital Practice, which is a huge insurance brokerage. And more recently, he started his own company. His company is really taken off. He's got a lot of great ideas, of course. If you want to go check out his page, nextimpactllc.com. You can take a look at that. He's also on LinkedIn. I always pull information off of LinkedIn. He's got a great profile on LinkedIn. So welcome, Lester.
Awesome, great. Thanks. Happy to be here.
Yeah. And so I think the best way to get started today, folks, is to just get right into some slides that Lester has put together. And typically, I just kind of like to start by asking real quick, Lester Morales, I do know that you are a kiteboard enthusiast. Just last week, we were chatting about this. Lester got really lucky. He went out to kiteboard school and learned how to be a kiteboarder. But beyond that, Lester, who are you? What brings you to the industry? Give us a minute or two about you.
Yeah. Again, thanks for having me. Unlike most everybody probably on this phone who I don't think anybody goes into 5th grade and they, have career day and everybody dresses up as an insurance professional, right? Most people back into this business. I actually have my degree in risk management insurance. So this is all I've ever done. And I've done it my entire professional career. I approach this industry very differently than most because of obviously the personal experiences I've had. Unfortunately, my dad was diagnosed with multiple myeloma, which is cancer of your bone marrow, when I was 15 years old. Bone marrow transplant, chemo, radiation, and hundreds of thousands of dollars of bills. My parents, when I was 17, filed bankruptcy. And so going into college, I remember my parents were giving me $250 a month out of my dad's disability policy. So when I heard about an insurance major, I'm like, well, this is kind of a sign. I think I got to do this. And so I've had an amazing career. I've actually, funny, somebody asked me this the other day. I've actually never placed a fully insured policy.
Oh,
I started my career at Sun Life, and I have been doing self-funded my entire career. Most of my career was at Willis Towers Watson. I grew my own $3.5 million book as a producer by the time I was 30. And then I ran sales for North America. So I had about 200 producers that worked for me across the country. And for the last 5 years have been working with advisors on building some of the cool stuff that we're going to talk about here. So it's just lifelong, career long insurance nerd. I posted that on social media yesterday. Insurance Nerd Day was actually yesterday. So those of you who identify yourself as an insurance nerd like I do, yesterday was our day.
that's an actual day.
It is an actual day.
Okay.
Yeah. And I would be remiss to say also 2014, my favorite person in the world, my mother, was diagnosed with pancreatic cancer. So by the time I was 40, I lost both of my parents, Gray. And so, I get up with a little bit of a different fire in my belly about how stupid, crazy, dumb, broken this system is. And so when I get to do things like this, especially with a company like you guys who wake up with the same mission, I get fired up.
Cool. Well, thank you, Lester. We did talk about your family a little bit last week, and we do hear those stories from folks. They get involved in this industry because they see how it's broken, or how it's not working for the people they love the most. So, thank you for sharing that, and my heart goes out to you and your family for that. So. Let's get into some questions here for you. I want to get over to the next slide. And I do, again, folks, I love the topic today. Don't fall into the trap. Let's get into the topic. Again, from our previous conversations, Lester, we recognize that it is a crazy world out here. Certainly when it comes to what we just talked about, but also COVID, okay, inflation, the Great Resignation. Everyone's talking about this recession we've got coming on. Like, is it going to happen? Is it not going to happen? It's insane. And then on top of all that, we have the reality of the healthcare world, and the spend keeps going up. It's just crazy for these employer groups. How can they keep offering a competitive benefits package when you've got all these employees that, they can't even use it. They can't even touch their benefits because their copays are too high, or their deductibles are too high, or they don't understand their insurance, right? That's a huge thing. And so from your perspective, Lester, what are we staring at right now? What does the world look like?
Yeah, it's interesting when we chatted about the title of this, right? Brokers beware, don't fall. I remember, and I'd like to think that I had a nice career and was kind of more innovative than the average, but the majority of brokers and most clients, we approach the business the same way, right? It's you run your year. At some point, you start talking about a renewal. You shop it to the same, 3-5 cast of characters that don't have any vested interest to actually save anybody money. And we go through this rat race the same. But, this year is an interesting year because of what is going on. And you read every article that is out there, and there is not an employer out there that is not having the same issues with talent. Like you said, the Great Resignation. I have a client that had to take their minimum wage from $12 to $15. So they've got the upward pressure on the salary side of the house just to stay even. And I got to tell you, if I'm an advisor out there and I think that I could show up and do the same thing and the same process that I did last year in a scenario where a client is going to say, broker, you are completely out of touch with what we are going through right now. And when you think salaries and benefits, human capital cost is typically 50, 60, 70% of an organization's P&L. And there is no way in a year like this that I think a broker can go into it the normal way. So I love the title Beware, because it is something that is going to create a lot of opportunity for brokers that are going in on the other side and having different conversations.
Right, exactly. I mean, there's so much opportunity if you look at it that way too, as opposed to all the pain. So let's get into it. So you've got some slides here last year. You've got a story. So talk to me about that story. Talk to me about where you want to go with this.
Yeah, I think the first thing that we fall very, very subject to a lot in our business is, thinking that every client is the same, or, said a different way. If we don't understand the destination, where a client wants to go, what is important to that particular client, we're missing the opportunity. And so I'm gonna take this, Heath and I are both, sales guys, right? So we're gonna take this as a growth conversation and say, at the end of the day, we are having a conversation to how do we grow blocks of business. And this screenshot, although very bad penmanship, and it is mine penmanship, so I will say that, this is actually an employer roundtable that we did. And if you're brokers out there, I would take out some notes, and this is liquid gold. I promise you this. If I had any one thing that I can attribute back to my production success at Willis, outside of just making 100 cold calls a day, was doing this. And so I think about this, and we have so many great ideas, right? We're going to talk about reference-based pricing and some of the things, but we all have this toolkit, right? In our toolkit in our business right now, if you are somebody who is okay doing things differently, the toolkit is full. You got plenty of tools in there, but the tool's only applicable if the job calls for it, right? You can't take a wrench into something that needs a hammer. And so understanding what and when a wrench or a hammer is needed. And so one of the things that I really encourage everybody to do, whether we're talking about a roundtable situation, a seminar, or even your own client where you've got multiple people at different levels in the organization in the same room, I really encourage everybody to ask, what's your number one goal? What's your number one challenge? And if you can wave a magic wand and change anything about your health benefits program, what would it be? And so this was a flip chart that we did actually in a live event. There was 13 clients sitting around a round table at a particular broker's office, and we did this question. And so I wrote down obviously their name, but what it is that they said. Now, Gray, the coolest part about this is it doesn't change my presentation. It didn't change anything about what I was going to talk about. What it allowed me to do is bridge the gap.
Okay.
Clients don't understand how the solution can help them accomplish the goal or the objective or overcome the obstacle that is important to them. So then when we got done and we talked about the ability to waive deductibles and co-insurances when people get to the highest quality healthcare, I got to call on Cammie and say, Cammie, in the beginning of the meeting, you told me that recruitment, retention, and hiring people was a big concern. Do you see that how having the conversation with a potential recruit about your benefits program and the ability to get them to the highest quality, lowest cost and waiving their cost changes the recruitment conversation? So we were having a benefits plan design conversation, but the bridge, right, the solution where they wanted to go, what was important to that person was recruitment retention. So the bridging of the gap allows everybody to sit back and say, I see now how I can use that hammer to accomplish my goal.
Yeah, absolutely. I mean, we do actually speak about that a lot on this show. We talk about plan design, how do you work it out? And if you can just bridge that gap between sort of what the client needs and what they want, and how do you provide that as a brokerage? I think that's the real key here, Lester.
Yeah, and this, I can't tell you I mean, so just fast forward. That was 4 weeks ago that this
Okay,
picture was taken. There was 13 clients around. This broker is now actively engaged with 6 of those 13.
nice.
So when you think about it from, every aspect of growth, right? The opportunity to, expand that. But the other thing is, if we all truly believe, and this is a little bit of a rah-rah, about this, but the coolest part, in my opinion, about doing what it is that we all get up every morning to do is the ability to impact lives.
Yes.
And I have brainwashed myself that every morning I get up, I know that we can actually make a difference. And so if we don't sell that account, if we don't get that account, that is 100 lives, 300 lives, 500 lives at that employer that we are not impacting. So I think of it that way. So if we're able to now take what we know in that solution, then man, we would be doing everybody a injustice by not spreading the gospel more, but the gospel is only relative if somebody wants to hear the gospel. So truly digging in the beginning of a prospect scenario, a webinar, a seminar, or just your own client, like, hey, client, what's important to you today? Oh, you want to open a new office in Albuquerque? What if I found you $150,000 in your health plan? How would that help you? Because every goal and objective that a client has requires money.
Yeah.
If we understand that money is trapped in their second or third largest expense, we become, as advisors, we become such a valuable tool for that client to accomplish their goals and objectives. We need to stop thinking that we only sell insurance and start solving problems.
Well, and there's just so many ways to point that out to them too, and find those cost savings. And I prepared a question that I'm going to ask you, and it has a lot to do with the difference between those clients who are using those traditional like BUCA style models. And so I do want to get into that. And I think that one of our slides might kind of relate to some of this stuff. So the sort of normal is, in case people are wondering, and when I was new to the industry, I was more familiar with the sort of BUCAs. Okay, the BUCA model, which is Blue Cross, United, Cigna, Aetna, Humana. Folks, you may or may not know the BUCAs out there. And this is the fully insured healthcare crew that we're all familiar with. And these folks, these BUCAs, they absolutely love to brag about their discounts and their networks. But the thing that I'm realizing after being in this industry for a little while, and certainly on the self-funded side, is should they be bragging about this? And I don't know about you folks, but I'm starting to think that they shouldn't. When they're giving you a great discount off a hugely inflated price, it's still really dang expensive. And for you, Lester, for us here at 6 Degrees Health, we are disruptors. And something that we've been talking about this week is data, and using data so that people can get a better handle on the true cost of medical care, kind of looking at it from the bottom up and that sort of thing. So Lester, what's your sort of take on this? How do we get the clients in front of it?
So let's take data in 2 parts of the conversation, right?
Okay.
We've got cost and we've got quality, and so we'll talk about that. And since we've got this slide, up, I'll
Okay.
just let everybody answer. Hey, what do they call the last place person that graduated from med school? Right? Answer being doctor, right? And it's really interesting, Gray. I did a talk last week. Last week I was on vacation. The week before that, and it was really interesting because it was a bunch of people. They weren't brokers. They were literally just business people. And I, relate, hey, what do you do for a living? And, they were an office supply distributor company. And I was like, let me guess. And I went through a scenario. So let's just make it personal to everybody. Last time we all bought a car, there is zero way that we drove to the nearest dealership. We got in the car we liked. We thought it was good looking. It had the keys in it. we turned on the ignition, we drove off, and we allowed them to invoice us 3 weeks later. But that's exactly how people access healthcare.
Right.
Like in the scenario of a car, can you imagine? I mean, I hope that everybody here knows this, but like, think about how your wife, your son, your cousins, your whatever access healthcare versus how they bought a car. I mean, people clip 39-cent coupons and go to Publix on Sundays to get their groceries with a 39-cent coupon. But that same person doesn't even think twice about where they're going to go get their MRI or the quality of their surgeon. And so I think it's really interesting having now looked back in my life and think, my God, you know, my mom gets diagnosed with pancreatic cancer, and think about it. The last thing you're thinking about is what the quality score of something. You're just like in a frantic panic. So wherever you end up going and getting in the healthcare system, that's the way you navigate. And if you're in Tampa, Florida, like we were, and your docs typically work for the hospital systems, where do you think all the referrals are going to go to? You don't hear that there's a specialist in this part of the world or whatever. And so people often complain about this, and they're like, man, you know, some of the recommendations people are getting are in another state or in another city. And I think, okay, again, back to that car example. If I'm in Tampa and Lakeland, which is, you know, an hour away, was a $3,000 savings for the car, people are going to drive the hour and not even think about it. Or if you gave somebody free tickets to the, you know, Green Bay Packer game and they live in Chicago, or you gave people in Green Bay Cubs tickets to go down into Chicago, they would drive 3 hours and not think about it. But at the end of the day, when we're accessing healthcare, people don't think. So if there's a battle cry as us as an industry, it is trying to demystify healthcare and make it like it was any other procurement, any other purchasing decision that somebody makes, because we shop the crap out of the cell phone that's sitting on our desk right now. We shopped our mortgages. We shop everything.
We're shoppers.
except healthcare.
And I guess the trick is, you know, how do we change that conversation, not just for the patients, right, but for the employer groups?
Yeah, you know, and I think first it's education.
Okay.
So first it is people don't know what they don't know. And so if we all understand that the buka has been the warm and fuzzy blanket, right? It's the safe spot. And if they're in Blue Cross's network, they have to be high quality. And so first it is just that education on that this information exists. So if you could flip to the next slide, I actually have some, and I got to give shots out to AIM and Nurse Deb. These are Nurse Deb's pictures. I just wrote recently with her a group out of Chicago. And, you know, I think of this, okay, mom gets diagnosed with pancreatic cancer. I am in Chicago. Where do I go? Funny, the reason this pisses me off is from the time you get off of your flight in O'Hare to the time you pick up your baggage, you will see several advertisements of Advocate, this healthcare system, in the airport. So if we go by advertisement, we're going to think that this is a great hospital, but look at what is happening here. A 99 score out of 100 of quality metrics versus a 4.
Yeah.
If this is your wife, your child, your mother, what are you doing? And so the first thing is this stuff actually exists. And that's the first part of that conversation is no one has ever seen the data to be able to even, hey, have you seen this data? Does United Healthcare? Do you think United Healthcare knows that Advocate is a shitty hospital, excuse my language, for cancer? They have all the scores. And if you think of our industry, what other industry actually do you make more money when you screw up? So think about that. So getting to the right person, the right time in the beginning is going to be such a big deal.
Well, let's get into. We talked about the quality versus the cost. There's probably more to say on that, but I do want to get into some of the solutions that 6 Degrees Health offers. Typically, we're not trying to necessarily plug our company here, folks, but we do have a really swift data analysis machine that we've developed. It's called MetaV, and Lester wanted to talk a little bit about MetaV today, just to kind of take that point and run with it. So using MetaV to mine data to figure out, hey, what are the best options for individual patients?
So, it's funny. I've never actually presented this data with somebody from 6 Degrees in the room. So Heath, if I say this wrong, just let me go with it. Don't correct me. You can tell me afterwards that I explained it wrong. But
no problem. Unless you totally butcher
it. When I show this, first of all, the conversation of this with a client, the first thing that I'm going to say is you automatically have wow factor. So I'm going to give you guys a lot of props that this is a very cool way to take a generic talk track and make it very customizable to a particular client and where they have employees. So very wow factor from the beginning, because most people have never actually seen, this type of stuff. So that's the first thing. The second thing that I always say, I talk about this in 3 pieces. Number 1, look at the price disparity between hospital to hospital. So, this is showing 312 hospitals or DRG. So it's a specific DRG, whatever 312 is. So there's 85 hospitals across the state of Illinois. And look at the price disparity. So this is the same exact service, DRG 312, whatever that is, and 85 different hospitals across the same state. So first of all, every blue and green cluster is a different hospital. So first, look at the price disparity between it. Crazy to think, if you're a consumer of healthcare and you have the 20%, so let's just say the employer is paying 80 and the employee is paying 20. If you have the 20%, don't you want to know the 20% of what? And so that's the funny thing, is like when Blue Cross, when the BUCA sit in front of you as an advisor, they brag about 2 things: how big the network is. So every Dr. Jones is in the network, every hospital is in the network. And first of all, we're going to debunk that by saying, do you really need everyone, or do you need the right ones?
Right.
So, I don't want to go to the hospital, even though it's in network that has a 4 out of 100 score. And then when we think about the cost, so discount, my 50% network discount. And I went to Florida State for school, so I'm never going to say that I'm the brightest of guys. It took me 15 years of my career to really, truly understand discount off of what? Discount off of billed charges. So the second thing that I talk about when I show this MetaV slide is the spread between the blue and the green. So the spread between that blue and the green is the spread between what that hospital gets reimbursed by Medicare and what they bill the commercial insurance company. So we just switched sides, and now we're in Cook County. So this is Metro Chicago. And you'll see here the ratio between billed and Medicare is 5 times. So at the end of the day, if you're getting this enormous 50% discount, at the end of the day, the average client is still paying 2.5 times what Medicare is reimbursing that same hospital for the same exact service. So when you think about that, again, even if, and I'm a huge fan of reference-based pricing, but even if you're a producer out there and you aren't yet ready to jump over to reference-based pricing, just the knowledge of educating an employer about what really their discount is, because if Blue Cross isn't a logo, the docs and their discounts, they're nothing, because the NPS scores of our industry, the only industry that is worse in NPS score, net promoter score, so how likely are you to recommend somebody to somebody else? The only industry that's worse than healthcare is your cable and internet provider. So what that means in real English, the only people that an average consumer of healthcare would rather talk to less than Blue Cross is their internet or cable provider. Like, that's how bad it is. So when you think about that, just the education. So look at the price disparity, look at the spread. And then the third piece, which is the piece that should really chap all of us, which is kind of counterintuitive to everything that we think about and everything that we know in every other industry. If you buy a nicer house, you spend more money. If you buy a nicer car, you spend more money. Healthcare, the better the quality, amongst the cheaper it is on cost. And that is absolutely shown in this. So you'll see that orange line that's running through the middle of that slide is the quality line. And so you'll see on the left-hand side, some of the best quality is also amongst some of the cheapest costs.
Right.
And so when you take this slide, it allows you to have conversations that, well, the so what behind it, but you're never going to get this information out of Blue Cross, out of Cigna, out of Aetna. It's just a world of different. And so it starts with having the data. So if you're fully insured block of business and you're saying, hey, I'm not getting any data, there are plenty of tools that help you get data, even on a fully insured group. But you have to, if you're a broker and you are not using data to make every single decision on what and how you advise a client, I don't know what we're advising a client on, because we've already proven the misalignment of incentives. Blue Cross, Cigna, Aetna, nobody has a incentive to actually lower the cost. Great. What does our clients call the or what does Blue Cross call the premium that our clients pay?
Profit.
Revenue. Yeah. Raise your hand as a broker if you wake up in the morning wanting to lower your revenue. But yet every single one, or most, the majority of the scenarios and the solutions that you're building for your client is asking Blue Cross, Cigna, whatever, to raise their hand every morning and say, yeah, I actually want to save your client money. It's not going to happen. The system isn't broken. The system is not broken. The system is completely designed incorrectly.
So I want to get into this discussion about renewals and taking a look at sort of a strategy behind, how do we get from, hey, I'm an employer group, I've got this really expensive plan I'm paying for with Blue Cross, it's not working. And then moving over towards self-funding, and what's that journey like? But before we get there, Heath, are there some of these Q&A questions? I know that there's a lot up right now, and I want to make sure that we're getting to some of these as we're in this topic.
Sure. Yeah, some of them I think we've answered as we've gone, in terms of whether this recording will be available afterwards, which they all are. And I posted the link there, but you can find it on our website. So let's see here. There was a couple. One, Lester, I think this you may have mentioned, but they're curious where you got those quality scores on one of your slides earlier, and I think you mentioned NurseDeb and Ames.
Yeah, but it's a platform called man. Of course, I'm going to draw a blank. I'll think of it in a second. But yeah, NurseDeb. That's part of the quality scores that they do. And quite honestly, Heath, it's not anything different, just displayed differently than that quality line that's running there. Yours is more of an aggregation, as opposed to that one's broken out into some details, but it's not much different, just displayed separately.
Yeah. The MetaV, one of the things that we're working on, and I'm not here to plug 6 Degrees here, but is how that quality gets built into these, because in the wrong hands, it can be improperly utilized. If you're not looking at how someone bills or something, they may just look at a provider and think this is where I need to go, but without understanding the underlying data. Those things all play a part into this. Is it aggregate data? Is it just hospital-wide data, or is it specific to that particular procedure? And all those things have to be understood. So,
yeah, I just remembered it. It is Quantros is the name of that system. QUANTROS is the name of that system. But But again, the interesting part about most of these guys is it's self-reported. This is self-reported data that the facility, the provider submits because they have to, because CMS requires it. So if a provider wants to take more than $1 of reimbursement back from the largest payer out there, which gets me on my soapbox, never allow a carrier to call themselves the payer. That absolutely just drives me crazy. They are nothing more than the facilitator of funds. Your client and their employees are the payers of healthcare, period, the end. Rant over.
Absolutely. No, that's a good rant. Heath, any other ones you want to throw in before we kind of change the conversation?
Yeah, we'll try and Lester, you can answer this, I'm sure, but why would one hospital pay more for Medicare than another hospital?
Yeah, so back to self-reported, part of that self-reporting is like what it actually costs the hospital to run their business, right? And so you can imagine a hospital in San Francisco has a higher cost than a hospital in Iowa. And so just because the DRG or the CPT is exactly the same, two hospitals, because of how they report their cost data, could get reimbursed. And then that quality, if you have heard obviously of the CMS 3-star, 4-star, 5-star rated facilities, that's also a way that CMS encourages good quality, because the reimbursement actually is higher for the higher quality hospitals. So again, that is self-reported data.
Nice.
All right. Why don't we keep going on this presentation, and
Awesome.
I'll read through all these Q&As coming in.
So I promised you a conversation, Lester, about the pre-renewal strategy. And I'll just use an example. I think everybody here can understand this. I mean, I've got friends. I'm in my midlife. I've got lots of friends with families, and they don't touch their insurance. They are afraid of their insurance. And it's shocking to me, because I think it's at this age, we should all be going to our checkups. We should all be, even a lot of this stuff, these checkups are free for folks, but they're still not doing the follow-up, or, anything from the dental care, the eye care. There's just roadblocks in the way. People are afraid of the deductibles. They've got these really high copays. And frankly, from my perspective, even with the huge premiums, right, it doesn't work for people. And we talk about broken, not broken. I guess that's beyond the point. But what I want to know, Lester, is when you've got these clients sitting in a room and you're trying to convince them that, hey, self-funded is a good model for you to look at. What does that process look like for these folks on the call? Sometimes we have HR professionals and employer groups in here. What does that conversation look like?
Yeah, first, again, you can't give guidance without data.
Okay.
So, it's going to first start with the data, right? Understanding, I mean, as something as simple as a fully insured to self-insured analysis. I met with a group the other day, 900 employees fully insured, and the guy was bragging about getting surplus checks back from the fully insured carrier, the loss ratio. And I was like, well, they probably one, they gave you back your own money, so congratulations, right? Two is, did they give you all of it? Did you get exactly what you deserve? And the guy kind of looked at me. I said, the reality of being self-funded is that you get back 100% of the surplus. Yeah. And he would have thought, like, I told him that, the world isn't flat, right? So the first conversation is just showing a client their own data. Yeah. Is first, and then fully insured, self-insured conversation. Is it for everybody? I'm going to say it's for most people, not every year, right? Not every year. So there are going to be scenarios that a fully insured carrier will take a flyer at something and lose. Cool. Like take a flyer at that. But over a period of time. So that's going to be my first conversation, Gray, is that nobody should look at healthcare, period, in 1 year increments. their client is going to have employees and a business next year and the year after and the year after. So as an advisor, stop looking at things in 1 year increments and talking about it like it's, a finite, a start and a finish. It is a start and a finish from a budgetary standpoint, but it's not a 1 year conversation. Two is when people say that they lost in self-funding. We were self-funded once, or my client was self-funded once. Heath, you probably heard this, it drives me bonkers, and we lost. I said, that's interesting. You've been fully insured. How many years in a row have you gotten a rate increase? 12. You've lost every year. Like, understand what it is that we're talking about and be able to have that synonymous way of thinking that says every time you got a rate increase, I hope you're not thinking that's the jackpot of winning if we were in Vegas. So first of all, let's start there, right? Don't think of it in 1 year increments. And this isn't a 1 year I won loss kind of conversation. Two is if a client never knew their exposure, then you were just a crappy broker. So anytime a client says, oh, they lost, I said, well, loss, you should understand your expected and max exposure. You should never lose. You should pay more than maybe you did if you were fully insured, if that's happened. That shouldn't be we lost. That should be your claims came in higher. And now the conversation of what are you doing to minimize the 85%, right? What are the tools, the strategies, the incentive design, the communication design, the contribution strategy, the plan design, the different tools, resources, vendors, partners.
Right.
What are all of those to actually do something about the biggest bucket, which is obviously claims?
Right. Do you want to get into some of these other slides? Yeah. Let's.
So I would tell people this. It's a very easy conversation to get away from the norm. And the norm doesn't necessarily mean, and so I'm not saying the norm has to be jump from fully insured over to reference-based pricing. But if at the end of the day, you're not gearing a client, you're not showing them that destination and you are the journey, right? The client, who is the hero in the story, has a goal and objective. You are the Yoda, right? You are showing them the way, and the way doesn't have to be there in 1 day, 2 day, 1 year, 2 years, but clients want to buy from somebody they trust that is going to guide them. That's what an advisor does. So first of all, stop calling yourself a broker, because a broker is transactional and an advisor actually does what we're talking about.
Nice.
Secondarily, when we think about this from an overall standpoint, thinking about it from a couple of different, the lowest hanging fruit is always prescription drugs. Lowest hanging fruit, the bar is so on the ground, it's ridiculous. But when we talk about just healthcare in general, if we understand, and so using MetaV slides is fantastic in this, that the cost and quality of healthcare changes depending on where you go, and you understand that there are advocacy companies that can help people navigate that healthcare system. Now it is, how do you actually get an employee to do it? And so I can't tell you how many times I sit with an employer and they're like, I don't think my employees will do that. That's interesting. Your employees cut 39-cent coupons, and you don't think that they would make one phone call to save $3,000, $4,000, $5,000. So back to the numbers, Gray. The average deductible nowadays is over $3,300, $3,400, I think is the last number I saw. If you double that, that means that someone's out-of-pocket masks is approaching $7,000. The average American, according to the last Federal Reserve report, doesn't have $400 in the bank.
Yeah, people can't afford that.
Those numbers don't make sense. So if we understand that you could pay $3,000 for the MRI over there, or partnering with Dr. Dickerson at Green Imaging, you could pay $350 over there. Then how do we get people to go over there? Because again, that same person is clipping 39-cent coupons.
Yep.
So now it's, how do we do that? And so this is part of that incentives work. Since the day we could, be tall enough to make our beds, our parents have been incentivizing us and bribing us. right? You make your bed, you get an allowance. You get good grades, you get that new PS5. Or, on the other end, you get your ass kicked, right? If you don't get good grades, I mean, whatever it might be. But the reality of it is incentives work. And so what's great about the conversation as we go down the continuum from, little change to more change is that it could be all carrot and no stick. Hey, that $3,000, $5,000, $10,000 expense that you had over there, it's going to stay the same. If you are okay working with the advocate, you're going to get a recommendation, and now healthcare is free. And so now the opportunity of incentivizing somebody, the real magic starts when now you've got like you guys in the background helping with the reference-based pricing. And instead of paying the 50% of something that was overinflated 700 times, now you're able to pay a more transparent cost up approach as opposed to a top down approach paying there. So the marrying this is such a big deal, because I know that you guys hate being lumped into, reference-based pricing is just paying less for healthcare. Well, yes, in a theory, but it's not one isolated strategy. It's the combination of different strategies that are all put together that makes this successful. But the strategy of reference-based pricing, as this example, is all lumped in because there are other people out there that are just saying, we're going to send you 120% of Medicare, screw you if you don't like it. And so the whole conversation of how do you marry all of these together, incentive design, contribution strategy, communication and education to employees, the plan design itself, the partners that you pick doing it, the reinsurance company that allows you to do this. Because back on that other slide, they allowed you to make $5,000 of a deductible go away. Do you understand what $5,000 is to an average employee? And the reason it works, because you're going to get asked this question. Well, wait a second. If I'm giving somebody free healthcare, aren't I paying more money? And then the next slide that you had up there is the why it works.
Sure.
It never ends up being wrong. The math never catches up. The math always works when we're getting people to the highest quality, lowest cost, when we're using alternative forms of reimbursement, when we're doing all of the strategies as a holistic, as opposed to throwing widgets up against the wall.
And I mean, the truth is that, the average employee doesn't have any clue that this even exists. And really you're talking about, excuse me, changing the conversation, right? Really getting a different conversation about how health benefits work and how the employees integrate with their health benefits in order to utilize them, and then not make the company go broke by sending money out the door to some premiums that they're never getting back.
So great, but I think we overcomplicate it in our business, right? Like, so I find myself doing this, right? I'm going to try to teach the advisor and the employer so much about how the sausage is made. But at the end of the day, the one thing when we stand in open enrollment meetings, so I just enrolled a 7-1 group, about 900 landscape workers. So most of them spoke Spanish. The one thing we said it 71 times in 42 minutes, call the advocate. For everything, call one person. And so I think that that's the conversation with the advisors too, is you have to work with partners that have integrated in such a way that the how to use it. If I got to call this person when this and this person here, I'm getting warm transferred here and this and this and this and this and this, it's going to be confusing. But if at the end of the day, the message is, hey, call here, go where they say, and it's free.
Yeah.
For the average person making $13 an hour, they're going to take that. So
that's the answer.
Right, I think that that's the easiest thing. Teach them that the data is there, that the outcomes is there, that the differences in the spread and pricing and cost is there. But don't make them think about that. Make them use and have a journey of a user just being like, call this one number and they're going to tell you what to do.
Right. Well, thank you, Lester. I really appreciate it. I feel like we got through a lot of what we intended to talk about today. Love your passion. Certainly, I understand it more now that I've gotten to know you, where it comes from. and frankly, just bringing it to a real, does the sausage taste good? At the end of the day, it's like, that's what the employee wants. And frankly, that's what the employer should want too. So thanks for making that clear. Heath, we've only got a few minutes left. Is there another question out there that we need to get answered before we wrap up?
There's a couple sitting here. We kind of touched on the peripheral of them, but I'll throw them at Lester and let him take a shot at. How is quality rated? Is it consumer score, return trips to the hospital for same diagnosis, et cetera, et cetera?
Yeah, so there are, again, depending on the platform, there are various metrics around that, right? So CMS has their own metrics. Some of these different data platforms, depending on what you do, they score different ones, but they're going to be your standard, readmissions. They're going to be things like mortality, morbidity rates, things of that. So again, what I want to make sure, especially on y'all's slides, it's self-reported data. So like when people try to, kind of, oh, well, that's not fair. It's like, well, wait a second. Okay. And this drives me crazy. We don't make a decision for the 5% of people that are going to be pissed off that we're telling them to do something versus the 95% of the people will be like, oh my God, thank God. Health insurance and health care is super confusing. Thanks for shedding some light on there. Yeah. They are different, right? They are absolutely different. Health insurance and health care are two totally different things. But Heath, I bet you get this all the time, is like people dig into what does the actual thing say? And it's like, well, let's take a step back and say, have you ever even seen the data? Like,
wow, there you go.
Well, let's start with that. And people get so hung up on, well, what is the detail? And I need to know everything before you just go have a conversation that says, absent of that, we are completely flying blind.
Right. Welcome
to our MetaV platform, which is available to those that we're working with. You can click into an individual provider and see, what are the different quality score categories. Now that says CMS quality scores, and take that for what it's worth. As Lester's pointed out, you're dealing with some vagueness there, but you are able to look into the quality and the financials of each one of these providers, and that's something that we're using when working with our reference-based plans, also with contracting initiatives and things of that nature, to really understand the market that we're working in and or the individual provider or procedure that we're negotiating on.
Excellent. Folks, we've got just a few minutes left. I do want to just throw it at you, Lester. What's on the horizon, friend? What are you focusing on now, or what should we be focusing on now that'll kind of keep us ahead of the curve down the road? What's the next big thing? Like what's out there? What are you worried about?
I think for me, funny that my name is Lester Morales, but less is more, right? Like, I was one that came out of the box and was like, you got to jump in the middle of the pool because we can save 40% when we jump in the middle of the pool. But reality of it is, what I'm coming to find out is that clients and advisors, for all that matter, are skeptical, right? Like, prove it to me. And so back to that, whether we call it the crawl, walk, run, whether we call it a journey, whether we call it a continuum, whatever you want to call it, make progress. We know, so Gray, I wouldn't say the next best thing or anything new. The tools are there. The toolbox has everything it needs in there to make a just an exorbitant amount of value. Not enough employers are doing it because not enough advisors are talking about it. So, I would say, I've seen Heath in a employer meeting. I've seen your sales people, like, guys, I mean, and I'm maybe a selfless plug, but like those of us that are in the business that are here to support advisors, stop thinking that you have to be the smartest person in the room every time too. It is completely okay. And the analogy I always give is, if my personal financial advisor came to me and says, hey, we've got some folks internally that have an expertise in something that I'm not quite sure, but man, this thing is is making people 15% on their money. Would you want to have a conversation with them? I'm not going to look bad. I'm not going to look poorly at my financial advisor for looking out for my best interest and bringing me the expert. So, I would say, Gray, I wouldn't necessarily say that I'm really focused on like what's new, as opposed to we know what works.
Right.
With almost 100 implementations now, we know what works. Now the conversation is, how do we turn 100 into 1,000?
Yep.
And it takes everybody on this phone. And my last, soapbox is, it's a battle cry. I mean, if we take the double-digit rate increases that our business has produced for our clients, employers and their employees out there for the last 3 decades, that's a testament to everybody on this phone. Like, that's shitty results. It's just plain and simple. And so we have the opportunity, and I'm going to say the obligation, to actually do something about it. But it takes everybody switching their mindset from easy. It's not the easy button. This actually is more work, hands down. But the value that is created for the employer, and more importantly, their number one asset, the employee, as someone whose family filed bankruptcy, is so much worth the additional work. And PS, clients will pay for value, just like you would pay for value. So stop being scared about having that conversation. Know that the tools and resources are out there, and know that there are people like 6 Degrees, like us, like anybody else, that will go with you and handhold you through the process, because we all have an aligned mission, which is to change the crap that's out there and the rat race that we're in, because the definition of insanity is playing every day in our business.
Well, thank you. Thank you very much, Lester. Lester Morales, everybody, founder and chief executive officer over there at Next Impact LLC. Super stoked to have you. Would love to see you again with us. Connect with Lester on LinkedIn, folks. He is a disruptor. We are a disruptor. Here is Heath Potter, the chief growth officer here at 6 Degrees Health. Reach out to Heath if you have any questions. We are doing another Fireside Chat next month, August 16th, everybody, 2022, 11 a.m. Pacific Standard Time. We've got Keith Smith. He's the co-founder of the Surgery Center of Oklahoma. Sometimes we like to jump into the provider world, and Dr. Smith is known for his revolutionary approach to the pricing of healthcare and uncompromising free market principles. So please join us next month, folks. We love having you. If you've got some more questions, keep those questions. We will be emailing everybody here on the call, and you will get an opportunity to reach out to Heath and get those questions answered, or LinkedIn. Find us on LinkedIn and become friends with us, and we will push it out that way. Thank you so much for joining us. I'm Lester. Thank you very much.
Guys.
Great to see you again. And Heath Potter, everybody. Thank you, Heath.
Thanks, guys. Great job, Lester. It was fantastic. Appreciate it.
Thanks, Heath. Appreciate you guys.
All right, everybody. Till next time, Fireside. Take care.